Some of you might recall that last year was our first year announcing the Housing Hero Award at Clare Housing. And as last year's recipient, I have the honor of announcing this year's award winner. This award recognizes the work of a staff member, volunteer, or donor who has made an exceptional contribution towards creating home, health, and hope for individuals living with HIV. And this year, 2020, keeping residents and staff healthy has been our #1 priority. That being said, it is truly my honor to announce that this year's honoree is Clare Housing's Director of Nursing, Megan Williams. Having both a master's degree in public health as well as a BS in nursing, Megan was well poised to make a large and lasting impact to Clare Housing after her arrival to our agency. She was eager to jump into our community-based housing and care settings where she could put both of her areas of expertise to good and immediate use. And she has gotten a lot done in these last 10 years. She was first hired by Clare Housing in July 2010 to be the lead nurse at Clare Midtown, the largest supportive housing project in our portfolio. Early on, Megan identified areas where we could focus our resources to expand and deepen medical orientation, training, and services for both staff members and residents. She helped develop a new nurse orientation protocol and training protocols. Having no director of nursing at the time, Clare Housing asked Megan to begin volunteering to attend local and regional conferences and trainings through MDH and care providers to better understand the multi-pronged licensure requirements of our Class F medical license and then later our comprehensive home care license. As we expanded, she got to work updating these policies and procedures across all of our nursing sites so that Clare Housing would have consistency in nursing operations across our programs. She improved upon the formal training that our unlicensed medical personnel, our resident assistants, would complete upon hire and regularly thereafter. She flushed out and improved how our client care plans were written so that they would truly reflect the detailed, individualized care that each resident needed. She's been an active member of our Safety Committee, our OSHA Committee, our TB Committee, our Staff Training Committee, and Megan single-handedly is our COVID Prevention Committee. She worked with the program staff to identify the best methods to document our services and to select and implement our client software and EMR system. She was instrumental in getting this new EMR system rolled out to staff. Clare Housing realized that a director of nursing position should be created to write, monitor, and supervise the ever more complicated medical cares that are provided to our residents in our medical programs. She did all of this within the context of a housing-first harm reduction setting that was weaving together best practices of both services for the homeless and in the delivery of medically nimble home care services to a very vulnerable population. She built a well-coordinated, talented nursing staff, which is integrated fully within the agency's overall staff. In 2018, it became clear that Megan should be more involved in the writing and submission of CADI service agreements, as her expertise in leveraging dollars for Clare Housing through more detailed written descriptions and her honed negotiation skills of our nursing services that are in play in these billing documents has resulted in a 25% increase in our rates in these programs. In 2019, Megan took over the supervision of the caregiving services delivered within our community care homes, which again, we're serving a very medically fragile population with multiple needs. All of these responsibilities were squarely on Megan's plate as this new virus named COVID was making its way into our communities in early 2020. So Megan has earned this award via unanimous decision this year through her detailed, persistent, and tireless work, culminating in her excellent management of the COVID-19 virus at Clare Housing. She took the lead immediately to prepare us and deployed specific staff on her nursing team to research and implement critical protocols and supports to keep our residents and staff persons safe. Since COVID-19 erupted on the scene, we are proud to say that of nearly 80 on-site essential employees, only one part-time staff person has tested positive for the virus. And among our residents, only 7 residents have tested positive for COVID-19. These results are very impressive, given that we work in settings where our residents are free to come and go from their apartments. For us here at Clare Housing, we have benefited greatly from Megan's combination of academic prowess, her domestic and global healthcare experience, her passion for excellence in service delivery, her advocacy for a strong nursing presence within the agency, and in her solid persistence to lead Clare to deliver the best possible medical services it can deliver. Thank you, Megan.